So yeah, thank you so much for inviting me here today. I'm really delighted to be here sharing the messages with such a critical group of people who are well placed to act on what we've found out. So today I'm going to give you a quick insight into some of the findings from the work we've been doing on the COVID-19 Early Years Resilience and Impact Survey. I will refer to it as CETRIS because it's easier that way, but as we've already pointed out, I think every other person has a different way of pronouncing the acronym. So yep, I'll give you a quick background to the survey and then I'll present some of the key messages from the latest round. And I will spend a little bit more time going into detail for some of the findings of particular relevance to the younger age groups as well. So CETRIS is an online survey of parents and carers that we've run 3 times now since the end of the first lockdown. We designed this survey to address a clear evidence gap around how young children were experiencing and being impacted by the pandemic. So very early into the restrictions, we were concerned that this experience could have several negative impacts, and it became clear that there wasn't anything set up to try and capture that. So CETRIS was born out of the need to be responsive to try and get an understanding, knowing that it couldn't do everything, but that it could at least capture some experiences and some impacts for some families. So rounds 1 and 2 focused on 2 to 7-year-olds only, as we had been keeping a track of other work that was being done, for example, by the Children's Parliament and YouthLink and others, but that this age group looked like the biggest gap. We did know at that point that under 2s were also a gap, but we also knew that due to the big differences in development, it would be almost 2 separate surveys that we'd need to run to look at those under 2s, and we just didn't have the capacity during the height of the pandemic. However, by round 3, we did open up to 0 to 11-year-olds to address a growing lack of understanding in that wider age group, and we created a set of complementary but tailored questions for the under 2s. So with these surveys, we're trying to capture how living through the pandemic might have impacted the health and well-being of young families in Scotland, and in doing so, provide timely intelligence to policy and practice decision makers to guide improvements to the way children and families were supported during the height of the pandemic, as well as now that we're moving through different recovery phases. So round 3, which I'll be basing the presentation on today, had just under 6,000 responses, with each response representing a child within the age range. And we did hear from families from all local authorities across Scotland. But it's important to note that we used open and self-selecting recruitment methods for this survey, and as such, CETRIS is not a representative sample. We have compared our sample demographics to national benchmarks, and while we're very similar in many respects, we do underrepresent low-income households, children with Asian or non-white ethnicities, and young parents. So before I talk about the findings, I think it's helpful to spend a little bit of time describing the context at the time of each of the surveys. Round 1 happened as things were beginning to open up after the first official lockdown. Families could start to meet with others, but outside only, and with strict physical distancing for everyone. And at the point of starting the survey, children were included in the physical distancing rules. And schools and childcare had not yet reopened. Round 2 was conducted after restrictions had lessened further, and childcare and school settings had reopened. Infections were beginning to climb at the time of the survey, and we had started using the tiered system, with some families living under stricter restrictions than others. At the time of the survey, there was no talk of a second lockdown, although this did start being discussed and did eventually happen not long after we closed the survey. And as we all know, the second lockdown lasted a lot longer than the first. While ELC in primary 1 to 3 returned to in-person teaching relatively early, and that was thanks in part to findings from CETRIS 1 and 2. Sorry, has somebody put their mic on? I'll just pause for a bit to give a chance for that to go off.
You're sounding clear, Megan.
All right, maybe it's just feedback in my headphones then. So thanks in part to findings from CETRIS 1 and 2 that had highlighted the negative impacts. ELC in primaries 1 to 3 did return early, but strict restrictions remained in place until around April 2021. And for kids who had already been in and out of routine several times, the summer holidays then saw them out of routine again. And CETRIS 3 was conducted after most restrictions had been removed. again, and childcare and school settings had been back open after summer for around 2 months. And just finally, it's important to note that Omicron had not yet surfaced at the time of round 3. Now, if any of you have children in the age range and took part in any of the surveys, you'll know that CETRIS is a pretty hefty survey. We do cover a lot. And this is because while the focus was on child health, wellbeing and development, we were careful to take wider contexts into consideration, such as parental wellbeing, economic circumstances and physical environments. And I just want to highlight right at the start some key general themes within the data before I go into more detail. So overall, the findings do suggest that for a substantial portion of children in our sample, parents and carers perceive the pandemic to have had a negative impact on some aspects of child and family health, wellbeing and development. These impacts generally appear to be felt to a greater extent in families from low-income households who may have already been struggling before the pandemic. And the impacts do not appear to be universal. For some areas, families reported very negative impacts, while for the same area, other families reported positive impacts. And this is something that we shouldn't overlook. If I tried to cover everything from our surveys, I'd be talking to you all day, potentially all weekend. And believe me, I could after having worked on this for over 2 years now. So I'll just try and give some of the key messages from some of the themes that we cover, which are noted here on this slide. Okay, so looking firstly at child's emotions and well-being. We found that around 3 in 10 children in our sample were experiencing difficulties with their emotions, behaviours and mental health, with a greater percentage of children from the lowest income category experiencing these difficulties. To give you an idea of scale, a third of children from the lowest income category had SDQ total difficulty scores of high concern. So that was 33% of children from the lowest income category. That's nearly triple that of children from the highest income category, where 12% scored scores of high concern. And now I just want to look at the journey that younger children have been on in our sample in terms of the SDQ scores particularly. So I'm going to present a chart showing the strengths and difficulty questionnaire total difficulty scores for preschool aged children in our sample. So for those who aren't familiar with it, the SDQ is a validated tool that is routinely used for behavioural screening in children and young people. It measures 25 psychological attributes across 5 domains, which are conduct problems, hyperactivity and inattention, peer problems, emotional problems, and pro-social behaviours. The first 4 domains are summed to compute a total difficulty score. And the scores are then categorised into 4 groups, indicating where children might be experiencing difficulties with their emotions, behaviours and mental health. Helpfully, we have an excellent pre-pandemic comparison for this age group, as the Scottish Study of Early Learning and Childcare collected SDQ scores in preschool age children in 2019. So we can look at what could be expected compared to what we found. So let's start by looking at round 1 results. We found both a lower percentage of children scoring close to average and a higher percentage of children scoring very high total difficulty scores compared to pre-pandemic. So what happened in round 2 when restrictions were lifted for most schools and childcare, had reopened? Well, it was positive news. We saw the number of children scoring close to average move in the right direction. However, you'll see that the percentage scoring very high total difficulties scores remained stubbornly high. Now with the round 3, after that second lockdown, things got worse, even worse than it had looked after the initial lockdown. And to me, this suggests that despite initial optimism, the longer the disruption to children's lives, routines and interactions has continued, the bigger impact it is having. So let's look at children's interactions with others. For around 5 in 10 children, the pandemic had a positive impact on their interactions and relationships with people inside their home, which is a really positive finding. However, for around 7 in 10 children, the pandemic had a negative impact on interactions with people outside their home. And given the context of the lives and the restrictions we were living under, that's probably quite understandable. And despite the positive finding of 5 in 10 children reporting positive impacts on family relationships inside their household, it would be remiss of me to not point out that for 2 in 10 children, there was actually a negative impact reported for these relationships, these vital relationships with family members inside their house. So this pattern of relationship differences between, impacted differences between internal relationships inside the household and relationships outside the household was particularly evident for children under 5 years old, where we saw higher percentages reporting negative impacts on relationships outside the household, as well as higher percentages reporting positive impacts within the household. Looking specifically at 0 to 2-year-olds, most parents and carers reported a negative impact on their child's ability to adapt to new experiences, child's interactions with adults, regardless of whether they knew them or not, and child's relationship with extended family members, and as well as the child's reaction to being away from the parent and carer. So we can see quite a collection of ways in which the limited social interactions outside the house had impacted that age group. We also saw far more parents reporting worse outcomes related to speech and language development and imaginative play in this youngest age group, again sort of further indicating ways that the restricted social interactions affected the younger ones particularly. Moving on to bereavement. So around 2 in 10 children in our sample had experienced the death of someone important in their life since the beginning of the pandemic. And while the occurrence of bereavement was similar across income groups, socioeconomic inequalities regarding difficult experiences of bereavement during the pandemic were particularly evident. For the lower income category, over a quarter strongly agreed that children had experienced difficulties in coping with grief, processing the death, and not seeing the person before death, while a sixth strongly agreed that they were worried about what to say to the child about death. And these percentages were far higher compared to the highest income category. There was also an age gradient evident regarding questions around grief, with older children, so the 8 to 11-year-olds, more likely to have experienced grief and to agree or strongly agree that they had experienced difficulties coping with grief, processing death, and not seeing the person before death compared to the 5 to 7-year-old and 2 to 4-year-old age groups. However, the parents of the youngest age group, the 2 to 4-year-olds, were more likely to say that they weren't able, or they were unsure about how to speak to the child about death and where to look for support. And I'm quickly going to look at some areas directly related to the pandemic before going back to the wider impacts. The majority of children in our sample had been required to self-isolate at least once, and if you look at the chart over here, you can see that several children were having to do this repeatedly. 13% of the sample were living in a household where someone was clinically vulnerable. That could be the child themselves or somebody else in the household, and therefore might have been impacted in more in different, potentially more intense ways by, for example, more exaggerated isolation and fear, perhaps. And this again was greater in lower income households compared to high income households. And looking specifically at the experience of bereavement, which we've just spoken about, 41% of those who had experienced death and agreed to answer some more questions about it agreed that the restrictions in place during the pandemic had impacted directly on their child's ability to process that death. Okay, so going back to the wider impacts and looking at child's play and activities. Around 4 in 10 preschool age children in our sample did not routinely attend extracurricular activities like sports or parent and toddler groups once they had reopened, because this was round 3 where these groups had started to reopen. And far fewer children from the lowest income category were attending these groups or activities. The main reasons for low income households not attending were cost, long waiting lists, and a feeling that there was nothing on offer for them in their local area. However, there are some positives in this regarding play for this younger age group specifically, with parents and carers of preschool children reporting their children had better outcomes compared to both the younger infants and older school age children for areas related to imaginative play, concentration, the frequency of painting or drawing activities at home, and the frequency of playing or exploring outdoors. Okay, so for over 4 in 10 children, the pandemic was reported as having a positive impact on their time spent outdoors. Now, this is generally quite a positive finding, however, it is very nuanced. Far fewer children from the lowest income category were able to easily access outdoor space, including gardens and parks, so gardens at home and parks in their local area. And several of these children also had lower levels of active play outdoors and lower physical activity levels than pre-pandemic. Importantly, as well as having less access to green space and reporting less use of green space, fewer families from lower income households reported positive experiences of being in green space, both at home and in the local area. And this linked directly to safety, size, and other quality related factors. And while the impact was positive for many, the parents of 17% of children from the lowest income category reported a very negative impact of the pandemic on their child's time spent outdoors, compared to only 6% in the high income families. And it's not just the children themselves that have been impacted. We found that the parents of 6 in 10 children in our sample reported the pandemic to have had a negative impact on their own physical health, while 8 in 10 reported a negative impact on their own mental health, with far more parents from the lowest income category experiencing these challenges. We also found a clear association between measures of children's well-being and their parents' well-being, with a greater decline in behaviour and mood for children living in households where parents were experiencing low mental well-being. The negative impact on parental well-being was particularly evident for parents of younger children. Higher percentages of parents of 0 to 2-year-olds reported negative impacts on physical and mental health, increased challenges around the loss of parental support networks, and that they felt less connected to their family, friends, and the local community compared to parents of older children. Now let's look at parental well-being slightly closer. So we used the short Warwick-Edinburgh Mental Wellbeing Scale to assess mental wellbeing in parents. And we then used population-based norms to categorise their scores into low, average or high mental wellbeing compared to what we would see in the representative population. In all 3 rounds of the survey, the percentage of parents scoring low wellbeing is drastically higher than pre-pandemic comparisons, with relatively little change between the rounds, suggesting that parental wellbeing has been hit hard and continuously by the pandemic. One of the most important things that we found through our survey was clear evidence that the impacts of the pandemic have not been equal. In almost all areas we asked about, negative outcomes were reported in more families from low-income households compared to high-income households. We also saw worrying levels of negative impacts on household income and employment, which were again disproportionately experienced by households already living on low incomes. During the pandemic, we saw families who were already experiencing or at risk of poverty being hit the hardest, while simultaneously seeing more families move into a precarious financial situation. Given the current cost of living crisis, this has serious implications. So let's look a bit closer at economic circumstances of the families. Around half of the children were in our sample lived in households where the employment status of the main earner had changed at some point directly due to the pandemic. And just over a quarter of parents or carers stated that they had had their income reduced again directly because of the pandemic. For concerns about the future, responses from the lowest income category regarding income being reduced, being extremely concerned about employment status or a reduction in household income, and being unable to pay for essentials, including household bills, rent, mortgage, or childcare and food, are several times higher compared to the highest income category. For a number of children, we also saw concerns further indicating increasing levels of household stress, including increased shouting or arguing in the home, including with children, relationship breakdown, and drug and alcohol use. And I'm showing this because it's vital that we recognise the home context of our children, which can impact on the health and well-being of both parents and children directly. Activities to support, for example, play, social development and learning are unlikely to be as effective as if we ignore the stress in the children's home life. Given that the impacts of the pandemic have not been equal, recovery is not going to be uniform either. For the majority of families, simply recognising that children might be struggling with their emotions and social interactions will be key, because these behaviours are likely to be linked to children processing and reacting normally to an extraordinary experience. A focus on nurturing positive relationships, play and socialisation will likely be enough to help most children thrive. For others, we might need to get creative with how we deliver some of our services to meet growing population level need for support. An example here is delivering different models of speech and language therapy, which is something we're currently working on. Engagement and support for parents will be key, not only to help them recover financially, physically and mentally, which is crucial, but also to support them to help their children. Parents might be feeling very isolated if they're struggling with some of the challenges we've seen highlighted through this work. And they too need to know that they are not alone, and they need to be supported with the knowledge, skills and tools to be there for their child in whatever way is needed. And in some cases, specialist services will be required. The challenge will be learning to recognise those children who have been impacted the most and who have the greatest needs. And here it will be vital that key children's practitioners in childcare, education and health receive training to recognise and respond to families in need. And we have already started working with early learning and childcare sector to develop mental health training, for example. And just to give you a brief insight into what the support for parents and carers what support parents and carers might be looking for, here's the responses from our survey when we asked just that. The biggest areas of support need around what parents, the biggest areas of support and indicated were around what parents can do to support their children's well-being, learning and socialisation, followed by support directly for their parents' own health and well-being, with household stress related items coming down the last, which to me I found was quite a hearty finding, that parents, even if they are experiencing challenges themselves in their household, their biggest future support needs were directly about how they support their children. So just finally, what I want to say is that despite some of these findings being uncomfortable, I think it's powerful as well. So when we know there's an issue, we can and we must act. And that's something we've been trying to do ever since we got the findings from the first round, by influencing COVID policy to protect children from further harm. We've also been trying to flag issues of concern within sectors where they've been arising. So for example, the speech and language concerns that we were seeing, speaking to ELC staff around the mental health impacts, and other services as well, including health visiting and midwifery. But we can't act alone, and we need the whole system supporting children and families to recognise and respond to these challenges. And that's why it's great to be here today with you today, engaging with you all, and something that we'll be moving on to do more of now is just trying to get these messages out there and start a discussion about what we can all be doing to help recover. So I've just left some links. I'm sure the slides can be shared with you all afterwards, to where you can go in and find more detail about our findings. So we've got an animation, we've got a briefing paper, and then we've got a whole series of data reports that you can explore to your heart's content. And I've also got my email address there for anybody who wants to get in touch and find out more.